Well, February is National Heart Month, and at the Medical Center of Aurora, every beat your heart makes matters to them, and that's in this week's Focus on Health. They understand how vital your heart health is to your quality of life and how important your quality of life is to you. So each year, their dedicated cardiologists and cardiac surgeons enhance the lives of thousands of patients. Joining us now is Cindy Gillian. She's a nurse practitioner, a cardiac nurse practitioner from the Medical Center of Aurora, and we're so glad to have you here today. Such an important topic. Cardiac diseases, including stroke, are the nation's #1 killer. Who is really at risk for heart disease?
Well, really anybody can. It can be at risk. It's really important to sort of know what your risk profile is. Unfortunately, we're seeing people coming into the hospital in their 30s with heart attacks. So it's kind of scary.
It is very scary.
Talk about some of the signs and symptoms that people should be aware of.
Well, definitely any sort of chest pain, especially with activity. So if anybody's doing an activity and they begin to have chest pain, shortness of breath, fatigue, pain down the arm, usually the left arm, nausea, vomiting, pain in the jaw. With women and diabetics, they can have atypical symptoms. They could just not feel well, stomach pain sometimes, but those people really need to take those symptoms seriously and at least get checked out.
Do you see an increase this time of year when people are shoveling snow outside and things like that? I can imagine you do.
You do, because any type of physical activity can definitely aggravate something that might be going on.
Yeah.
But probably the most important thing is to sort of know your risk profile. And what puts people at risk are things like family history. Unfortunately, that's not something you can change, but it is something that you should know about. So if somebody in your family has had a heart attack, and the closer the relationship to you, so for instance, if it's a brother or sister, mother, father, that becomes even more important. So knowing that risk, knowing your numbers, so your blood pressure, your cholesterol, your glucose level, if you're at risk for diabetes, that type of thing. And then, of course, just the things you hear all the time, staying at a healthy weight, exercise, all important things. And most importantly, probably the single most important thing you can do to prevent heart disease is not smoking.
And then, I'm sorry.
No, I was just going to say, you hear that a lot, know your numbers, and a lot of this is sort of a catchlead that people are talking about now. So as you said, education is the key to prevention.
Absolutely. And the Medical Center of Aurora is known for their leading cutting-edge treatment and preventative care. Talk a little bit about that.
So we have a great cardiac center. It's wonderful. Some of the great best cardiologists there, and just we focus a lot on prevention. So helping patients, especially if they do come in and are identified with heart attack or stroke, making sure they get the appropriate education, knowing what their blood pressure should be, because a lot of people don't know what that number should be or what it should be under. Having them keep track of that and knowing what a healthy diet is when they go home. So those types of things are
very, very important. There's all kinds of heart-related diseases that they vary. So it is important. There are some great screenings happening at the Medical Center of Aurora, and we've got that information. But first, we'd like to thank you for joining us. Cindy Gillian, cardiac nurse practitioner from the Medical Center of Aurora. Thank you again.
Thank you.
Thank you. That's right, February is National Heart Month, and the Medical Center of Aurora is offering free heart health screenings throughout the month around Aurora. There are 2 more screenings this month. Each will offer cholesterol tests. The next one is on Wednesday, for February 23rd from 7:30 a.m. to 10:30 a.m. at the Medical Center of Aurora main campus, and that's at 1501 South Potomac Street.
Then there is another one on Friday, February 25th from 8 a.m. to 11 a.m. at the Centennial Medical Plaza. They're located at 14,200 East Arapahoe Road in Centennial. Screenings offered include cholesterol levels, BMI, blood pressure, and heart disease and stroke risk assessment. For the cholesterol test, 8 hours of fasting is recommended to obtain an accurate result. No appointment is necessary for heart health screenings, and the free screenings do not include calcium scoring CT scan. If you'd like more information, you can go online to auroramed.com or call 303-695-2600.